So thank you so much for having me today. I'm really excited to share some results from the Brain and Behavior Infant Experiences Study, also referred to as the BABY study, which is a project I've worked closely on with Emily Dennis, as well as Lucy King, Kate Humphreys, and Ian Gottlieb, titled The Effects of Maternal Depression on Infant White Matter Organization and Social Emotional Development, a longitudinal study. I think everyone here is aware that major depressive disorder is a common psychiatric condition and that women are particularly susceptible to experiencing an episode of major depressive disorder. What you may not know is that it's estimated that 20 to 40% of infants have mothers who experience depression during or in the year following birth. So here's a graph that Dr. Michael Meany shared at SOBP last year, emphasizing the importance of assessing depression along a continuum. So the x-axis shows prenatal depression scores from the Growing Up Towards Healthy Outcomes study, and the y-axis shows the frequency of these scores. And though you can see that approximately 10% of the study sample is falling within the probable clinical range, a whopping 30% are in this high subclinical range. And it's important to assess depression along a continuum, given that even depressive symptomatology in the high subclinical range accounts for important variability in offspring outcomes. Maternal depression is associated with a variety of adverse outcomes in offspring. Some examples include higher rates of preterm birth, poorer cognitive functioning, such as lower IQ, and more attention problems. Further, there's evidence of higher rates of externalizing or internalizing problems, more behavioral problems, worse physical health, and finally, it's associated with a heightened risk for depression in offspring. And importantly, the timing of maternal depression, so whether it's experienced during the prenatal or postnatal period, can impact offspring outcomes in offspring differentially. So just in this table to orient you, a check mark means that the researchers indicated or reported a significant result. It's not here in this case, but an X would indicate that they reported a non-significant result, and a blank indicates that the researchers didn't assess depression during this time period. So more recently, we've learned that higher maternal depression is associated with both poorer and stronger white matter organization in offspring. But there are very important differences to consider in these studies of maternal depression and offspring white matter organization. So some important distinctions include a difference in the diffusion metric assessed. So some researchers focused on fractional anisotropy while others focused on radial diffusivity. There's a wide age range in the participants, so the youngest being 2 weeks old and the oldest being around 10 years old. They implicate different regions of the brain, so some focusing on subcortical structures and others implicating more long-range white matter pathways. And again, the timing of depression. So some are reporting significant results during the prenatal period and others reporting on results during the postnatal period. So given the rapid brain development that occurs across early infancy and childhood, we wanted to take a comprehensive approach and consider two competing hypotheses. So one possibility we considered was in line with the stress acceleration hypothesis, that maternal depression may be associated with accelerated white matter development. And if we found evidence for this, we would expect positive associations between maternal prenatal depression and fractional anisotropy in offspring. And if we observe this positive association, some underlying neurobiological explanations include potentially accelerated myelination, but also sort of premature pruning and disrupting connections that could have ultimately been proven useful down the line. Alternatively, maternal depression may delay the development of infant white matter organization. And in this case, we would expect a negative association between maternal depression and fractional anisotropy. And if we observe this negative association, this may be evidence for delayed or underdeveloped myelination, and this could occur in response to glucocorticoid toxicity, for example. This is a schematic of our longitudinal study design. So in the Babies project, we are interested in assessing how maternal characteristics impact the infant brain and subsequent behavioral functioning in toddlerhood. So mothers and their infants came in 6 months postpartum. Mothers reported on their pre- and postnatal depressive symptomatology, and infants were 6 months of age when they underwent the diffusion magnetic resonance imaging scan. 1 year later, mothers reported on their offspring social emotional development, so when the toddler was 18 months of age. So again, we sought to determine whether maternal depression would be associated with offspring white matter, considering both competing hypotheses of either accelerated or delayed white matter development in offspring. And if it was associated with differences in white matter organization, we wanted to determine whether it would also be associated with subsequent behavioral functioning in toddlerhood. So here's the relevant demographic information of our sample. About half of our sample was male. They were born full term. They were scanned between 6 to 8 months of age, with the average age being 7 months old. They were 18 months of age at follow-up as determined by study design. And mothers were approximately 33 years old and came from high income and education backgrounds. So infants were swaddled and fed prior to the scan and were scanned during natural sleep at the Center for Cognitive and Neurobiological Imaging with a 3T MRI scanner with a 32 head channel coil. Diffusion data were acquired with a multi-shell diffusion scheme with varying B values with isotropic voxels. The scan lasted about 6 minutes, and we reconstructed the DMRI data in DSI Studio and performed tract clustering and tract identification and TractStat. So here is our preprocessing pipeline. We had dual phase encoding so that we could unwarp the data during the eddy correction step. Deterministic tractography was done in DSI Studio. Each infant's FA was aligned to an infant template and the tracks were warped accordingly. Based on ROIs in individual subject space, we had preliminary tract clustering. So for example, anything that goes between the prefrontal cortex and the amygdala is called the uncinate. And then we combined to create a population bundle to know that we were looking at a representative space. And then from here, we looked at averages across the ROIs, deriving the metrics fractional anisotropy and radial diffusivity. So given the lack of consistent evidence based on the extant literature, we wanted to kind of approach the study with a broad consideration of different white matter pathways. So we grouped them into two sets of tracks. So limbic tracks, which included the cingulum, the fornix, the uncinate fasciculus, and the hippocampal cingulum, and segmentations of the corpus callosum. So looking at the genu, the body, and the splenium. So we use the Edinburgh Postnatal Depression Scale to measure retrospective reporting of prenatal depression. And we use the Center for Epidemiologic Studies Depression Scale to measure concurrent postnatal depression. And we use the infant toddler social emotional assessment to look at toddler outcomes. So you can see that all of these scores are falling within the normative range, bearing in mind the clinical cutoff scores, though there was a great degree of variability. We use multivariate regression analyses with continuous dependent variables to assess the contribution of both prenatal and postnatal depression in predicting fractional anisotropy of limbic tracts. And we controlled for infant age and infant sex. And before I continue, I also wanted to note that we included maternal antidepressant use, maternal education and income, as well as breastfeeding duration as covariates, and our models remained unchanged and the pattern of results persisted. And what you can see here is that after controlling for infant age and infant sex, neither maternal prenatal nor postnatal depression predicted fractional anisotropy in limbic tracts. We ran the same series of multivariate regression analyses in corpus callosum tracts and found that maternal prenatal depression was a strong predictor of corpus callosum FA, and that this prediction persisted after consideration of postnatal depression. When we ran post hoc ANOVA analyses, we determined that the fractional anisotropy of the corpus callosum genu was driving this association. And we can see that higher prenatal depression was associated with higher fractional anisotropy of the corpus callosum genu segment. And this is in line with our sort of stress acceleration hypothesis, where we see evidence for stronger white matter connectivity. So to further interrogate this, we looked at radial diffusivity of the corpus callosum genu and saw if it was associated with prenatal depression, and indeed it was. So higher prenatal depression was associated with lower radial diffusivity, which again is indicative of stronger white matter connectivity in line with the stress acceleration hypothesis. Finally, we wanted to determine if infant fractional anisotropy would be associated with more negative emotionality or problems in toddlerhood. And we did observe a significant association such that higher fractional anisotropy of the corpus callosum gene use segment was associated with more negative emotionality. And we're actually waiting on 6 more infants to age into this follow-up. So in conclusion, we found that higher prenatal depression was associated with stronger white matter connectivity in line with the stress acceleration hypothesis. And when we see positive associations with fractional anisotropy and negative associations with radial diffusivity, we see evidence for stronger white matter organization. So again, one possible explanation is accelerated myelination. Other neurobiological substrates that are important to consider include increased fiber density in axonal packing or more uniform fiber orientation. We can also extract additional measures such as neurite orientation dispersion and density imaging, or NODI imaging, and look at values such as the orientation dispersion index or the intracellular volume fraction that can provide more information regarding the underlying neurobiological substrate. We also have quantitative MRI data, and we can examine myelination more directly using an R1 measure. But really interestingly, these findings are suggesting that variability in white matter organization during gestation may be one possible mechanism by which there is an increased intergenerational transmission of depression from parents to offspring. And so we're really interested in examining this further, though we know that more longitudinal work needs to be done to determine the lasting effects of maternal prenatal depression on infant white matter organization and whether adverse behavioral outcomes persist into older childhood. So with that, I want to thank you so much for virtually attending this talk and for your attention. I'd like to thank Emily Dennis for all of her help with creating the preprocessing pipeline and being an active kind of mentor during this project. I also want to thank Lucy and Kate for their fundamental role with their help and their help in this project. I also want to thank 2 incredible research assistants who really collected a lot of this data, Fran and Jill. And finally, I'd like to extend my sincerest thanks to Ian Gottlieb, who's an incredible mentor and has been providing me with extremely helpful feedback and for helping me develop my research interests. So thank you so much.